It is a debilitating disorder that affects 1 out of 10 women of reproductive age. It can cause pain and infertility. It can also affect organs like the bladder, liver, and lungs. We are talking about endometriosis. Some doctors say women don't know that they actually have it for years, and for patients, treatment for this disease can be quite difficult. Some doctors also say it can take an average of 6 to 10 years to properly diagnose endometriosis, and that process usually takes multiple surgeries. Today in the 4x4, we are taking 4 minutes during the 4 to learn more about the new efforts to diagnose and treat women and how you can help raise awareness. I am joined now by Dr. Camran Nezhat, endometriosis expert and founder of the Worldwide Endometriosis March, as well as one of his patients, Laura Thompson, here in the Bay Area. Thank you both for coming in. Laura, let's talk about your personal story, if you don't mind sharing here. 3-4 years ago, you and your husband say, we want to have children. And take us from there.
So about 3 years ago, we started trying to have a kid, and I couldn't get pregnant. I knew after about a year we wanted to seek professional help, and we did. And after multiple diagnostic tests, we were told everything was normal, there's no good reason why you're not getting pregnant, but we were advised to pursue various fertility treatments and take fertility drugs.
Right.
And after a year of just not getting anywhere and still didn't know why, huge answer to prayer, we found Dr. Nezhat, and I had no idea, but I had endometriosis. I've had it probably since my teens.
Did you ever bring it up with your primary doctor or the doctor when you were trying to get pregnant, saying, is this a possibility, or did he or she ever say this is a possibility?
I didn't bring it up,
right.
But the doctor initially said, we don't know why you're not getting pregnant, but it could still be this and this and this. The only way to tell if it's endometriosis is through exploratory surgery, and she didn't recommend that.
Got it.
There wasn't a great diagnostic test for it.
So, doctor, I was reading that a lot of these symptoms can be quite painful, but in Laura's case, she didn't have these painful symptoms. Where's the difference?
No, the issue is endometriosis. We call it a great masquerader, an enigmatic disease, because it could have a very small amount of endometriosis, could cause significant amount of pain and discomfort and organ dysfunction. But a lot of women or a couple who try to get pregnant and they have all of their tests is normal, practically have no pain at all. The only symptom is that they don't get pregnant.
So do you find that some doctors avoid talking about this disorder in some cases when you're talking about being able to get pregnant and not succeeding at that? They just block it out of their mind?
Correct. The problem is, unfortunately, there are not a lot of awareness about endometriosis. It is such a common disease. More than 10 million American women and young girls, they have this problem.
100 million plus around the world, right?
That is correct.
Right.
That is correct. It's a very, very common disease. Approximately, as you mentioned, around 200 million women have it around the world, so it is very common. And the problem is that it is so common that everybody thinks it is normal. So if it was pain was normal, all the women had pain, but only 1 out of 10 women have so much pain that they have to stay home at the time of every month, or they might have, they cannot go to school.
So you've done this new procedure over the last few years that you performed on Laura?
Right.
Not as invasive. Explain what you do.
But the issue for endometriosis is, unfortunately, we don't have any blood tests or any ultrasound or imaging, MRI. We cannot diagnose it.
So you have to go in.
So we have to take a look. But now we can talk with minimally invasive procedures, the small incisions in the abdomen. We can look by video cameras and diagnose the disease very effortlessly.
How young of a patient have you performed this procedure on? Do you recommend only, say, 21 and older?
Well, the procedure by itself, it is a good idea to perform when everything else fails,
right.
But usually it could affect very young women. I have had patients as young as 8 years old who has had endometriosis, but we don't recommend for an 8-year-old to have a surgery. Or we have to go through steps and evaluate the patient, and unfortunately sometimes takes 6 to 10 years for a young girl or a woman to be diagnosed with the disease because of, it takes that long. So what we are trying to do, we are trying to raise awareness among the community, the same way people know about autism. endometriosis is far more common than autism, but people, they don't know about it.
And you're going to do that this weekend, and we'll mention that in a second, but real quick, Laura, when did you have this procedure done?
I had it done in November of 2015, this past November.
Okay, and then you went back and attempting to get pregnant, and you got pregnant.
We got pregnant in December.
What was your reaction to after so many years, unsuccessfully getting pregnant, and then all of a sudden?
Lots of tears and thanking God.
Yeah, and how are you feeling right now?
I feel great. I'm about 4 months along, and we did an Natera test to find out that it was a boy. So we're going to be having a baby boy in September.
You have a son coming.
Yes.
Awesome.
Yes.
Congratulations. What would you recommend to other women who maybe were in your position now that you were in 2-3 years ago?
Take charge. Be your own advocate. It took us taking charge of that and seeking a second opinion and not just taking I don't know for an answer. Right. And really just taking charge of your own health and our fertility in this case, and think about endometriosis. Talk about endometriosis with your doctor.
Okay, are you going to be out there this weekend at all?
I'll be out there.
Okay, awesome.
Yeah.
Let me tell the viewers what we're talking about. I think we have a full screen up, but it's the 3rd annual Worldwide Endometriosis March. That is Saturday, March 19th from 12 in the afternoon to 8 o'clock at night. It starts right there at UN Plaza on Market Street, 7th and 8th in San Francisco. It is the 3rd annual. Doctor, you founded it. Congratulations.
Thank you.
And you said there was going to be a special guest there too, right?
Right. We have the past president of American Medical Association, Dr. Robert Waugh, and also past president of American Society of Reproductive Medicine, Dr. Linda Judice, who is also the chair at UCSF, and also president of Society of Laparoscopic Surgeons, Dr.
And Laura Thompson.
And Laura Thompson, and many of our other friends. And
thanks, Doctor. I appreciate it. Have a wonderful event, and thanks for telling your story. I appreciate it, Laura. Congratulations. And we do have a link at KTVU.com for more on all of this topic.